Hello, I'm Craig Steiner, a physician with an engineering background. I've practiced medicine for years, always with an eye on creating technical solutions that fit the workflow of clinicians. Today we are talking about GermSoft, an infection management software solution that is embedded in your EMR to work for you. GermSoft slides into your workflow. It was created by clinicians, for doctors, pharmacists, infection preventionists, and for the financial team. All of this in the IT manner that makes it most usable. Let me introduce James Curtis. His credentials are seen on the slide. His responsibilities include medication optimization, antibiotic infection preventionist work, and consults for clinicians.
The antibiogram within GermSoft is one of my favorite tools on the platform. As a clinician working bedside, it offers valuable real-time insights into what's actually going on the broader level. The nice thing about the antibiogram in GermSoft is it gives you a real-time snapshot on your specific area of interest. So for example, if I'm working in the ICU and I want to know what my real-time antibiogram snapshot looks like in that intensive care unit, I can use GermSoft to look at that. So contrast that with what typically happens at the hospital level is that you have a large global antibiogram. Perhaps it's unit specific or ED specific, but typically only gets updated once a year at best. So typically you're looking at somewhat outdated information when you are referring back to that antibiogram. So one nice thing is, in my experience, it's nice to be able to have that real-time snapshot, and then you can encourage providers to actually go in and use that antibiogram for real-time decision making. One of the other valuable tools within GermSoft is the antimicrobial stewardship module. I find it very, very helpful in my day-to-day work, working bedside in the units throughout the hospital, specifically looking at targeted antimicrobial therapies for specific patients. One of the challenges in today's landscape for pharmacy practitioners and providers throughout the hospital is there is an abundance of information within the EMR. And when we're talking about antimicrobial stewardship, those same folks, now that COVID is around, are often tasked with the challenging aspects of COVID, but then also are typical and accustomed hospital epidemiology challenges with different bacteria, drug resistance, and in antimicrobial stewardship, selecting the right drugs for the right patients for the given pathogen. One of the features within GermSoft is not only the ability to combine all of these patients with specific diagnoses or specific suspected infections within list, but to also give you all of the necessary clinical decision-making information all in one nice, easy to navigate location. So as the clinician, I'm not filtering through, clicking through different screens, logging into different systems. I'm not navigating outside of my EMR to a web-based application. It's all nice, neat, in the same location. One of the nice features of the antimicrobial stewardship module in GermSoft is that in addition to giving you your hospital's formulary, so which drugs are the preferred agents, it also tells you a lot of information about the specific drugs just at a quick glance. So one example is if drugs have certain restrictions on them. For example, let's say you have ID restrictions for some of the higher generation carbapenems, for example. That information can be included right here in GermSoft, so I don't have to navigate somewhere else and look to see what's on the hospital's restricted drug list. It also gives you information about perhaps other drug-drug interactions, drug-disease interactions, if those diagnoses are on the patient's chart, also any allergy history information. It also will tell you at a glance here if the drug bacteria is resistant or susceptible to that given choice for the antibiotic coverage. The drug cost is also listed. Oftentimes, given the choice between two different drugs, clinically equivalent, the providers aren't necessarily in tune with what the drug costs. And so just given that information, sometimes that can influence decision-making by the provider to choose the less expensive option. One of the nice features of GermSoft is that it gives you a specific list of organisms which can be then reviewed by your antimicrobial stewardship practitioner. The example listed here, you can see some carbapenem-resistant isolates that are listed, some Acinetobacter isolates which are listed, all of which can really streamline your activities for the day. So I'm not flipping out, looking through a list, looking through various charts, trying to find these disease states. They're all at a glance. And so if this is something that's reviewed twice weekly, 3 times a week, every day, it's all nice, neat, and in the same place. Another nice tool within GermSoft is the antimicrobial tracking feature. This is really nice on a patient-specific level when you're trying to track and figure out what happened to this patient and how did we get to where we are today. It's not uncommon to have patients' antibiotics changed seemingly every day within the hospital. And so having a mechanism where you can review each drug listed with the dates that they were changed and then the reference labs associated with those decisions is very, very helpful. I know sometimes that can be very challenging when trying to give feedback to practitioners about why did they choose A or B or C. The empiric antibiotic therapy module within GermSoft is an extremely helpful item offered within the program. This module gives the hospital the ability to input their own specific pathways for different disease states. So the item listed here is community-acquired pneumonia. You can see the drug regimens listed there. Again, this is fully customizable for whatever the hospital determines is their best practice. The value in this is, these protocols likely exist somewhere within your facility already, whether that be on a printed list on some website or within perhaps your EMR somewhere already. But again, the value of this is it is a easy to find, all in the same place, bit of information, which can really help with decision making for the providers. This way they don't have to carry a pocket reference. You don't have to worry about having an outdated form printed on the floor. It's all listed right there. In addition, you can see that you can actually place comments regarding each therapy specifically, which is very helpful as well.